Dr. Ballard's research focuses on positive youth development and understanding the implications of civic engagement for youth and community well-being. And what she's going to do for us today is talk about this intersection between physical health and civic health, and really dispel the notion that these things are separate. In fact, that they're intertwined. And the more we focus on civic health, the more we actually create a robust framework and foundation for physical health in this country. Over to you, Dr. Ballard.
Wonderful. Thank you. Give me 1 second to start sharing my screen. And is that looking good from your end? Okay, wonderful. So thank you so much for the introduction and for the invitation to be here with really inspiring speakers and the people I met yesterday in my networking group. It's just so nice to be in a space with people really thinking about this intersection of civic engagement and health. So I'm Parissa Ballard. I'm assistant professor at Wake Forest in the School of Medicine. And this is kind of the focus of my own research, which is how young people develop a sense of community and contribution to their community and how that intersects with their health and well-being. I am going to focus on the research this morning, but with humility that it's Saturday morning and not everyone in the room is a researcher. I'm going to try to keep it high level as I talk about some of the major findings that kind of set the stage for what we know about civic engagement and health and well-being. So just by way of an introduction to me, I'm a developmental psychologist by background, studying young people and how they develop and how we can support their thriving. And my particular niche area is civic engagement. And so why have I chosen to study civic engagement? Researchers sometimes say research is me-search. So, we often pick a topic near and dear to our own heart. This is a flyer I found a few years ago. I was helping my parents move, and I found this box of stuff they kept, of course, from when I was little. And apparently when I was 8 years old, I had a real heart about the environment, and I thought that it was a good idea to pass out flyers to my entire neighborhood about how to save the planet. So this says this flyer is to try to get the message across to everybody, help save the earth. All it takes is 5 minutes a day, just take some time to pick up litter. Clearly, I was a little bit misguided about how complex the problem was, but as an 8-year-old, I really cared and had some efficacy that maybe this would make a difference in my community. This is a table of contents. Apparently these flyers were many pages long, and chapter 1 was about picking up litter. Chapter 2 was about reclickly, which I believe is recycle. I was not a very strong speller, but on the back it says these flyers were made by Parissa and Sarah. We are interested in making a difference, age 8. And so I think as a developmental psychologist, this is a real story of continuity. It's always been something that I've really cared about, the issues in my community. And I came to understand that I could study that as a topic of research about how people are integrated and caring about their community. And now my research is on how, what the function of civic engagement is in healthy youth development. So thinking about civic engagement and health, I have to recognize that we're in a really particular moment in time right now for studying this topic. So of course, I'm talking about the pandemic that made it kind of touch and go, whether a lot of people felt like it was a healthy and safe thing to do to vote in the election, and yet people showed up in droves just to do that, to make their voice heard in a time that it was very stressful and difficult to do that. We're also, of course, in a time that might be described as a racial reckoning, kind of our country really, it's come to our public consciousness about systemic racism in kind of a new way. Not that the issues are new, but people are really reckoning with, some of the systemic injustices that are around us. This is a screenshot of a report in The Lancet that really is imploring healthcare providers in particular to think about political engagement and voter registration as a health issue. And so it's kind of an exciting time where people are really recognizing that this intersection between civic and political engagement and health and well-being. So when we do talk about civic engagement and health, we have to really think at both the individual level and the community level. And I really like this about the Vot-ER initiative, is that they really are thinking at both levels, right? So as healthcare providers or clinicians, we're often thinking about the patients right in front of us, right? Providing care and promoting health of the people in front of us. But civic engagement, of course, is also a community level issue, right? We have Vot-ER talking about civic health, or the health of a community to mobilize and address issues that are important to the people who live there. This is a screenshot. I won't go into the detail, but I have spent a lot of time mapping out what I think are the relationship between these levels, right? So how me as an individual, my civic engagement can promote health in my community, but my health of my community also feeds back and supports whether I have the opportunity to even get involved in the first place. So I have asked somebody to drop a link in the chat to this paper where I kind of map out what I think are all the different ways we can think about the intersection of civic engagement and health at both levels. But today I'm talking about really the individual level. So that's what a lot of my research focuses on, is what about individual level civic engagement, and how does that affect health and well-being? So for a definition, I'm going to define civic engagement as collective actions that are designed to identify and address issues of public concern. And that's a really general and broad term, but of course there's lots of different kinds of civic engagement. And so there's political action, a lot of what we're talking about today, things like voting and campaigning. Those are what I would consider really traditional political actions. For young people who may not be eligible, things like student government. Then there's activism. I think that kind of fits into what Dr. Hahn was talking about with kind of movements, community organizing, maybe things like attending a protest or a rally. And then you have things like volunteering, which you might think of as more at the individual level, kind of direct service, helping others, things like tutoring and mentoring. So when I say civic engagement, conceptually, I mean all three. But in my research, I always tease out what very specific form of civic engagement I'm talking about, because they have really different implications for health and well-being. Okay, so people ask me, right? So what does civic engagement even have to do with health? You know, some people, I think not the people at this conference, but some people say like, what is the connection? I'm not sure I get it. So I will answer that for myself, but I also like to play this podcast clip. This is a young woman who was at Colgate University. This was a few years ago, and the university was experiencing a lot of issues with racism. And this young woman was getting involved in activism as a response. And the podcast host, is from a podcast called Reply All. The host asked her, why are you so involved in activism in the face of a lot of backlash, right? She was getting a lot of grief and backlash about it. And here's what she said.
There were other people who in the classroom, they would talk about welfare, and they talk about students like myself who are on scholarship as not deserving or not belonging. And I think that my first year I was very angry because of it. And then after that, you know, you gotta do something about it, because you can't just like sit around and be angry. That's how you gotta get headaches and die.
So I really like that. This is what I like to call a lay theory of the relationship between civic engagement and health. In this particular context, she's talking about experiencing discrimination. You have two choices. You can do nothing about it and then get a headache and die, or you can do something about it, in her case, through activism. And I guess presumably you then are protected from headache-related death. I'm not endorsing this theory, and I wouldn't go that far myself to say that that's actually the process that happens, but I will say I hear this a lot in my own research, the idea that especially that activism can feel like a really important way to cope with your life circumstances, especially things like experiencing oppression or discrimination, that it's so bad for your health to experience that not doing something about it feels terrible. And doing something about it in the form of joining together with others to address underlying issues can be really empowering and really health promoting. So civic engagement and health, how are they related? Well, people in my studies and others say it can help you cope with stress. So for example, the stress of oppression or discrimination, it can be a really active coping mechanism. It makes you feel good. It can lift your mood. It can actually be active. So if you think about like canvassing in your community or getting out in your neighborhood, actually being out in your neighborhood, working with others can actually be physically active and promote health that way. It can promote social connections. And there's a whole lot of research showing that social connectedness is really related with health and well-being. It can also really help people develop a sense of purpose and meaning. And there's a whole literature, especially for older adults, that volunteering especially, but other forms of civic engagement as well, can really help people define purpose and meaning in a way that is also good for their health and well-being. And finally, and this is really important, you can actually make healthy changes in your community. So it's not only the individual level of feeling good, but also actually working together with others to promote healthy change. And so I'd like to think back to what Dr. Benjamin was talking about yesterday, the example of food deserts and actually joining with others, the people in her community that she was talking about, to lobby to get a food market. And that's actually something that can then provide healthier food and change health habits and health access for people in the community. So there's also theory from developmental psychology in a little more academic terms, and we have positive youth development theory, which is the idea that when young people have what they need, they're connected, they have what they need in their community, then they become people who contribute to others. So there's this theory of positive youth development saying civic engagement is kind of almost a result of young people thriving. We also have a theory called socio-political development theory that focuses especially on young people who come from minoritized identities. Socio-political development is the idea of developing a critical awareness of things, especially if you experience oppression. Developing some critique of that and having the chance to take action towards it can be a process that can really promote health and well-being. So in my own research, I use a really multi-method approach to look at some of these questions. And I wanted to mention this because, of course, my not so secret agenda anymore for today is to inspire more research on this topic. And so I just wanted to mention for people who are interested in research, there's a lot of ways to kind of look at these issues. So I use survey methods, so actually giving people questionnaires and doing quantitative analysis. Interview methods, where we sit down and talk with young people one-on-one, we do focus groups and then do qualitative analysis. And then I do a lot of community partnered work where I partner with clinicians, community members, and schools to actually implement and evaluate civic interventions and see how it affects development like health and well-being. So I'm going to go through a couple different studies today to just show you, to get a flavor of what some of the evidence is that's out there. And this first one is a paper with some colleagues that was published a couple years ago about the impact of adolescent and young adult civic engagement on health and socioeconomic status across adulthood. So the research questions in this study were, I had been reading about these positive correlations between civic engagement and health, but I wanted to know, can we use a little bit more rigorous approach to see, is there a causal relationship? So does being involved in these kinds of civic engagement actually cause better health and well-being? So we were looking at civic engagement in late adolescence and early adulthood, predicting later health. Do the effects of civic engagement differ across 3 different types of health outcomes? We looked at mental, physical health, and health behaviors. And then do the outcomes differ on the form of civic engagement? So things we looked at were voting, volunteering, and activism. So in terms of study design, we did a secondary data analysis of this huge, beautiful data set from a study called Ad Health, which is nationally representative, huge data set. We looked at 3 waves of data. So at wave 1, the sample was just over 9,000 participants. We had 15-year-olds at wave 1. At wave 3 of the study, we collected the civic engagement measures. So everybody was around age 18 or older. So they were eligible to vote, most of them. And then the outcomes were measured 5 to 10 years later. So when they were into adulthood, and we measured health and socioeconomic outcomes. So I won't go into the details, but I'll say that we used a kind of fancy statistical approach called propensity score matching. And what that allows you to do is match people who are really similar on really important background characteristics, but who differ on civic engagement, to then see how their civic engagement relates with outcomes. So, for example, we know that people who come from higher socioeconomic backgrounds tend to be more involved in civic engagement. We also know that people from higher socioeconomic backgrounds tend to be healthier. So any association between civic engagement and health might just be because of socioeconomic background. So what we did was match people based on all these characteristics I have on the screen, but who differed in civic engagement. And then we could kind of tease out how civic engagement relates with health and well-being. And here's what we found. In terms of volunteering, we found that people who volunteered around age 18 had less depressive symptoms around 10 years later, and were involved in fewer health risk-taking behaviors 10 years later. The findings were different for activism. So there was no association between activism and depressive symptoms, but people who were involved in activism were actually involved in higher health risk-taking behaviors 10 years later. So really different kinds of associations there. In terms of voting, the pattern was the exact same as it was for volunteering. So voting, if you were around age 18 and you voted, then compared to people who were really similar to you in background, you had fewer depressive symptoms later in life and fewer health risk-taking behaviors later in life. So kind of the conclusion here, voting and volunteering seem to predict better health across the lifespan over and above some really important background characteristics. Whereas activism predicted worse health in some ways and more health risk-taking behaviors and did not predict depressive symptoms. I have a lot of thoughts on why that might be, but I'm actually not going to focus in on the activism findings today, although I have an active area of research on that topic. But today I want to talk briefly about two studies that we took those findings I just discussed and spun off into a couple different directions. One was looking at volunteering in health. So volunteering is really robustly positively associated with better health, right? So you're directly helping people, doing good feels good. We know that. Lots of people say that when I volunteer, that just improves my mood, it lifts my spirit. We also have research showing that there's biological benefit of volunteering. So for example, releasing oxytocin and improving immune function. So my colleagues and I wondered, okay, so we have these positive correlations, but can volunteering actually be used in an intervention to promote better mental health? And so we did this pilot study, very small, where we tried to prescribe volunteering as part of treatment for adolescent depression. So we know that depression is characterized by things like social isolation, feelings of low confidence and competence, and hopelessness about the future. So what we did was partner with clinicians who were already treating adolescents for mild or moderate depression or anxiety. And we prescribed them the intervention of 30 hours of volunteering. So we worked with them to choose what would feel like a meaningful opportunity for them in our local community, and then checked in with them as they did their 30 hours of volunteering. And here's what we found. So measured by the Beck Depression Inventory, people were in the clinical range looking at that green bar of moderate depression before the volunteering intervention. And then after completing their 30 hours, they were down below that threshold for mild depression. So they had really moved from moderate to minimal depressive symptoms. That's a pretty clinically significant difference. Now, I cannot say this is only because of volunteering. Because of our study design, these young people were also continuing their treatment as usual. So it could be a combination of their treatment as usual and the volunteering that was having an effect here. Future studies will look at having a control group to try to tease that out. But we did also measure things like, did they increase in their sense of meaning and purpose and self-efficacy? And we did. And we measured lots of other things and found that in general, people who, over the course of volunteering, people really did report an increased sense of meaning and purpose in life, and self-efficacy, which is the feeling that you can actually do something that matters in your community. We also found some really beautiful qualitative findings through our interviews. So overall, the study participants reported a really positive experience with volunteering. They said things like volunteering decreased my anxiety. So like, I think it helped my anxiety because I had to push myself out there and talk, right? So just the experience of being pushed for more social interactions helps some people with their anxiety. Some people said that it improved their moods. Like one young woman said, my mom noticed after I volunteered at the Humane Society, I was just all smiley and I just looked like I felt so much better. It gave them a sense of purpose. One young woman said, just helps you get out of bed and doing something productive and interacting with other people. And finally, really, participants felt like they were making a difference. So this young woman was working with a food bank, and they said, when you're feeding people, you're keeping people from being hungry, right? That's filling people's stomachs. You think to yourself, I never really had to deal with that. It's like, wow, we're really making a difference for someone. And so that feeling of making a difference can be incredibly powerful, but you also see here kind of a shift in perspective. So this is a young woman who's noticed, I've never personally had to deal with hunger. So just this shift in thinking of people outside yourself is also a really powerful experience. So I wanted to show these findings because these are about volunteering, but I want to also argue that a lot of these same mechanisms might work with things like electoral volunteering and electoral participation, right? You can think about your own life, right? If you're involved in an initiative to help people get registered to vote, you might also really feel like you're making a difference, right? You might also really feel like you're connecting with others and getting out there and have a sense of purpose. So I think a lot of these same mechanisms might be at play. And I think there's a lot of room to do future research, seeing if some of the stuff that makes volunteering so powerful also expands to kind of election-related volunteering. So moving a little more specifically to think about voting and health, so how might those be related? Well, you're making your voice heard, right? You feel like you have a voice and you can make it heard when you vote, right? When you cast a vote, that's empowering. People say, I feel like I'm doing my part, right? I have a civic duty and I'm doing it. It feels good to be enacting my social responsibility. With voting in a different way, but you're joining with others, right? You're joining with millions of other people who are making their voices heard. But you also, if you're registering people to vote or out canvassing, you are like literally and physically joining with other people to do something about a cause you care about, taking action on something that's personally meaningful to you. So the research on the intersections of voting and health is It's a newer area, so there's not a ton of research out there, but there is some. And so I wanted to quickly review what I think we know from the research. And so these are kind of 5 different points here. So I think, first of all, we know that elections can actually be really stressful. So I suspect a lot of people had this experience personally in the 2020 election and the 2016 election, that it felt really personal, that it was very emotional for a lot of people, that it was stressful. So we know, and there's some research showing with young people, including college students, that we experience physiological stress. So people, there's some studies that measure cortisol and different physiological stress measures, and show that around the election time, there was a spike in a lot of feeling physiological stress. We also know, in general, poorer health is related to lower voting behavior. So this is both at the individual level and at the community level. So individuals who have poorer health tend to vote less. It's also true that communities who have poorer health in general also have lower voting rates in general. But at the same time, and interestingly, poor health and especially very specific health conditions can really motivate voting behavior. So that makes some sense. If you think about something like someone who's very affected by a chronic illness might be very motivated to vote around healthcare reform, right? That's an issue that really mobilizes people. So for subgroups of people, poor health is really motivating. Finally, we know that interventions can increase voter participation. This particular Brown paper I have noted here is about interventions in healthcare settings. And they did a systematic review and found that interventions in healthcare settings, like registering to vote interventions, does increase voter participation. And finally, this is kind of a newer area, but electoral engagement might really help people cope with socio-political stress. So if we know that elections can be really stressful, participating in them can be stressful, but can also maybe be a way to cope with the stress that comes along with elections. And so here I'm with some colleagues. We just conducted a study where we collected data from college students across the whole country to measure self-reported socio-political stress, coping, and well-being among students in the 2020 election. And so what we wanted to know was, do people increase their election-related participation as a way to cope with socio-political stress? And we're just working on analyzing findings, but I can show a little bit. So we asked people on this survey to indicate how involved they were in the election. So they had to say what level of involvement they had in civic engagement around the election. And then we asked them to self-report how stressed they were. So we had a bunch of options. How stressed are you about this election? And then for the people who reported being somewhat or highly stressed and somewhat or highly engaged, we asked them, well, how are you coping with this socio-political stress? And then these were open coded. So they were free to type whatever they wanted. And these are the kinds of categories, then we coded them into the coping strategies. So the most popular was taking a break. So people said stuff like, when it becomes overwhelming, I just back away and take a break. I just log off, get off my phone or computer and stop paying attention to the news for a little while. The second most popular was self-care hobbies, things like I take a walk, I hang out with friends, I take care of myself when I get really stressed about the election. But the third most highly endorsed was people who kind of doubled down on their election-related civic engagement as a way of coping. So we thought that was really interesting. People would say, when I get really stressed and I feel overwhelmed following election-related news, I remind myself of what's at stake and I call more people to register them to vote. Right. So this is a way people would say, I channel my anger or frustration or stress and I try to even get more involved. And so we're still working on analyzing what this means for this college students' health and well-being. But I want to highlight here that there's so much we don't know. So this is a relatively new research area. Some people have been doing it for years, but in terms of the actual social science evidence, this is gaining traction right now. So for people in this room who might be interested in research or doing research, I really think that this is a kind of ripe area to really learn more. If we find out that voting is very stressful, then we have so many more questions to answer, like how can we support people to vote and get involved in elections in a way that's socially supported and connected and bolsters them and prevents burnout, rather than having people stress out and get disconnected from electoral engagement, because we need it, right? And as we've heard over and over again from Dr. Turner throughout this conference, democracy depends on our electoral participation. So we really need people to become engaged. So then I just wanted to kind of end by giving my take on why healthcare providers in particular should care about their patients' civic engagement. So as Dr. Martin highlighted yesterday, as trusted community members, you can provide an invitation into civic life. This is especially important to, I think, Dr. Martin's example of his patient who said, no one's ever asked me before to vote, right? It's really powerful, and it's a pretty true experience for a lot of people, that simply being asked and invited to participate in civic life can be an intervention in itself. And what you can do as a healthcare provider, or just as somebody who interacts with other humans, you can plant seeds, right? You can say, hey, this matters. You can help them see how their life is connected with electoral participation and invite them into civic life. And this can be really powerful. It can be good for individual patients' health and well-being. So we have that evidence showing that poor health is related to less voting. Voting, we think, is health promoting in a lot of ways. It can be really empowering. It can improve representation in health and well-being related policies. So again, voting matters, showing your voice matters. Health affects a lot of people, and people, if they know that they're, if they can see the connections between themselves and their lives and policies and get more people represented in the electoral process, then that's how democracy works and thrives. And then finally, it can improve community health and well-being. So again, connecting people to other people in their communities and having them address issues of public concern can feed back and create better health for people who live in those communities. And I do want to say, I am not a healthcare provider myself. And so I'm the last person who should tell healthcare providers how to use their very precious clinical encounter times. I know that those are really strained and stressed. And so I'm just offering how powerful it can be, since you're a trusted individual, to invite people. I'm not suggesting that it should be the entirety of the patient encounter, and you have so much you need to do when you're taking care of patients. But I personally think the Vot-ER approach of wearing lanyards and kind of seeding the conversation and really removing barriers is what can really help people engage more in civic life. And finally, I just wanted to note that I really focused today on the research at the individual level. So how individual civic engagement relates with individual health and well-being. But I want to circle back to civic engagement is also important for community, right? The main thing about civic engagement is that it helps democracy thrive, and it makes communities stronger when people connect with each other and solve issues that they're facing. So civic engagement, again, always thinking at these multiple levels, right? This is about individual health and well-being, but also civic engagement is what helps communities thrive. And I'll end with just another huge thanks for inviting me to be here today. Thank you to wonderful collaborators and funders. And please be in touch. I have put my email here, and I would love to hear from people and follow up more. And thank you very much.